who is on your diabetes care team. Why? Because knowing who is on your care team, you can go from one person to the next. Or if you don't have your complete care team, then guess what? You can also ask for people. Hey, like I said, look, you have a primary care clinician and your blood sugar is not under control, then you can ask for an endocrinologist. You can ask for a diabetes education. So that's why it's important to understand, what comprises a diabetes care team. So you can know who do you have on your team and who do you need to add if things are not going well. Let's go down this list. A primary care physician / clinician. That's your family doctor, your internal medicine doctor, a nurse practitioner, or physician assistant. So like I said, that's going to be your primary care person. That's going to be your point of contact. They probably diagnosed you with the diabetes and also kind of started you on some of your medications. So, and everybody that's listening should have one of them, okay? Whether you have diabetes or not, okay? Now, if you feel like the diabetes is not under control, and that is by monitoring the hemoglobin A1C on a regular basis, then a lot of times you're going to want to get to an endocrinologist. And this is an endocrinologist. They specialize in hormones, so like thyroid and things of this nature, but they also are diabetes specialists. Getting referred to them, they can kind of take a look and see if they agree with a treatment plan that you're on right now. They can do extra reinforcement as well. So endocrinologists are actually a very important part of your diabetes care team as well. And if your diabetes is not under control, if you're not reaching your targets, then you want to request a referral to an endocrinologist. Then you want to make sure you have an eye doctor. Actually, everybody needs to get some eye exams, but for diabetics, you need yearly eye exams, preferably the dilated ones. It's an ophthalmologist or an optometrist. An ophthalmologist is a physician, MDDO, that specializes in eye care. Optometrist is a clinician, the ones that you see like, maybe at Walmart and stuff of that nature. So what they're doing is they're looking for damage to your eyes from diabetes. The next one's going to be what we call a podiatrist. The podiatrist is for foot care. For diabetics, monitoring your feet is essential because with diabetes, you can get small vessel diseases and it can lead to your feet becoming numb, and or you can also get wounds on your feet. And worst case scenario, what happens is that people develop wounds, but because they can't feel their feet because of diabetes, that wound gets worse and worse. And you can get you get bad infections and you can require amputation if they can't get the wound under control. As a matter of fact, when you go to your doctor, when you go to your nurse practitioner, you go to your PA for your routine visits, somebody should be looking at your feet. Your shoes and socks should be coming off, and somebody should be looking at your feet on a regular basis, making sure that there's no wounds on there. They actually can do what they call a monofilament test as well. That's checking for diabetic neuropathy, but that should be done. And you should definitely have the name of a podiatrist in case you have any issues. People that have really bad diabetes, sometimes they will even get their nails and stuff trimmed by the podiatrist because they just don't want to risk anything happening to them.